Hello, everybody. For those of you who are watching us live right now, welcome to our very own, the first series of USAINS Vaccine webinar. And for wherever you are, I hope you are having a great time. Get yourself relaxed and, of course, get a good seat so we can start the webinar immediately. Welcome to the first series of USAINS webinar. And this program is especially brought to you by USAINS Group of companies. Do you know USAINS Group Healthcare Division consists of a very, very beautiful clinic that is located in Kota Baru, Kelantan. It is open for 24 hours and it's open to public, staff, and even students of USM and all dependents. So if you're interested to know more about the information, make sure you follow us on our Facebook right now. Go to your Facebook and check out USM Executive Health Services. To get treatment, you can always walk into the clinic and, of course, check out for more information at the Facebook itself. My name is Joanne, and I hope everyone is equally excited to start the show. Let me present to you a very, very interesting topic for today, vaccine webinar. What is it that you need to know? What you need to know exactly? How important it is to get vaccinated? How safe it is? Will there be any harmful side effect? Do I really need to be worried, or what will happen to me if I don't get vaccinated? There are so many questions in our head, right? So I hope everyone will channel your question to our experts for today. Just put in the comment section right now. Just like and give us some comments. And if you have any question at all, feel free to type it down at the comment section below so everyone can, of course, address it later on. Now, today we're in luck because we have a very, very interesting line of panels, and these are all experts from various aspects, and they'll be sharing with us their findings, their knowledge, their input about vaccination. Before we begin, how about giving us some response, okay? So I can see some response saying hi and hello from everywhere you are. So if you're from everywhere, you can just type up your location right now and just tell us, oh, I'm from Penang, I'm from KL, I'm from Kelantan. So just give us a big hi, okay? Now, let us give you a brief of what we have for today. And before I actually move over to the session, I would like to introduce to you one of our very, very great speakers today. He's currently a professor of medicine and senior consultant of endocrinologist in Universiti Sains Malaysia. And he's currently an executive director of USAINS Tech Services, as well as the head of USAINS Medical Group. And our moderator for today has also published more than 110 papers in national and international journals, and has been invited to give more than 520 lectures, around the world. So Professor Dr. Mafauzy Mohamed has currently been the chief editor of the Malaysian Journal of Medical Science and Journal of Asian Federation of Endocrine Societies, as well as Journal of Endocrinology and Metabolism. So many information about him, and this man is definitely the right man to moderate our panel today. Without further ado, let us have our very own Professor Dato Dr. Mafauzy on the screen to conduct the session and introduce all our speakers. Hi, Professor. Professor, you need to unmute yourself. All right, Professor, you're on the screen right now. Okay. Hi, Professor. You ready?
Hi, Joanne. Yes, I'm ready. Right?
All right. At the moment, we have a total of 130 over viewers, and it's still going on. And I can see a lot of people are already giving a response. So hopefully, Professor, we're going to have a good show today, yeah?
All right. Thank you very much, Joanne. Terima kasih, Joanne.
Stage is yours.
Right. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera tuan-tuan dan puan-puan. Selamat petang dan selamat bersama-sama kita pada pagi ini, pada petang ini untuk seminar ini. Ya, saya cuba nak share screen. Okay. Alright. Okay. Okay. Dia sebagai permulaan atau pengenalan kepada program ni, saya akan sentuh sedikit berkenaan dengan COVID-19 dan perkembangan yang terbaru. Dan semua kita maklum bahawa COVID-19 ataupun short form dia coronavirus disease 2019, dia disebabkan oleh virus ini, SARS-CoV-2. Dan kes pertama dilaporkan di Wuhan, China pada Disember 2019. Dan sejak itu ia telah berkembang dan membiak dan telah merebak ke 223 negara dan kawasan dan jajahan di seluruh dunia. Hampir semua negara di dunia ini telah dijangkiti oleh virus ni. Dan sehingga pagi ini daripada jumlah di dunia, lebih daripada 123 juta orang telah pun disahkan mengidap dijangkiti virus ni, dan menyebabkan lebih daripada 2.7 juta orang yang telah meninggal dunia akibat virus ni. Bila kita lihat trend daripada jangkitan virus dan juga kematian, kita lihat seperti di grafik ini, bahawa ada 3 peak ataupun wave, gelombang. Ini gelombang pertama, gelombang kedua, gelombang ketiga, dan kita sekarang ni bermula dengan gelombang keempat di dunia. Dia disebabkan oleh jangkitan terutama di Amerika Selatan, Eropah dan India. Jadi virus ini masih lagi membiak dan merebak di seluruh dunia. Kita sekarang ni permulaan gelombang keempat. Dan kita bila lihat kematian juga, dia ada 3 gelombang. Gelombang pertama, gelombang kedua, gelombang ketiga, dan kita juga akan ada gelombang keempat. Bila kita lihat trend kematian tu lebih kurang 2 minggu selepas trend kenaikan kes-kes baru. Jadi kita pun sekarang akan menghadapi gelombang keempat jumlah kematian akibat COVID. Apa dengan negara kita? Di negara kita, seperti yang ramai tuan-tuan dan puan-puan maklum, bahawa kes pertama telah dilaporkan pada 25 Januari 2020. Ini adalah kes 3 orang warga Cina pelancong yang didapati dijangkiti dengan virus ni. Dan sehingga petang semalam, Malaysia telah ada 335,540 orang yang telah mengidap dijangkiti COVID-19 ni, dan 1,244 orang yang telah meninggal dunia. Bila kita lihat trend juga, kita pun ada 3 gelombang. Gelombang pertama, gelombang kedua, dan gelombang ketiga yang kita tahu bermula daripada PRN di Sabah dan terus meningkat, diakibatkan juga oleh permulaan pergerakan rentas negeri pada bulan 12, dan pada bulan 1 kita adakan saringan pekerja-pekerja yang menyebabkan ada kenaikan tinggi di peak akhir bulan 1, dan semenjak itu dia telah menurun dan agak stable, tapi bila kita lihat masih lagi tinggi hampir sama dengan awal bulan 12. Jadi masih berada dengan kita walaupun kita pada masa ini bertahan. Jadi kita harus berwaspada supaya kita tidak ada satu lagi gelombang seperti yang dihadapi di kebanyakan negara di dunia. Okay. Bagaimana kita hendak hentikan pandemik COVID-19 ni? Okay. Tidak ada cara lain, hanyalah dengan virus, dengan vaksin. Sebab dengan apa yang kita buat sekarang dengan lockdown, dengan PKP, hanya akan menghindarkan saja jangkitan ni, tapi tidak akan memansuhkan. Dan juga kita melihat vaksin ni, dia tidak akan membunuh virus, tapi dia boleh mencegah kita daripada dijangkiti di para virus ni. Jadi risiko kita untuk mendapat jangkitan COVID-19 ni berkurangan. Jadi kita mungkin kurang risiko untuk mendapat COVID-19. Dan juga bila kita mengambil vaksin, kita juga boleh membantu untuk mencegah orang lain daripada mendapat COVID-19. Kerana bila kita divaksin, kita kurang mendapat jangkitan, jadi kita juga kurang akan memberi jangkitan kepada orang lain. Daripada itu panggil kita lindungi kita untuk lindungi semua. Jadi bila community vaccinated, hampir semua orang dilindungi. Ada beberapa golongan yang mungkin tidak dapat menerima vaksin, umpamanya golongan bayi dan kanak-kanak dan sebagainya. Jadi bila kita lihat perkembangan vaksin di Malaysia, sehingga 22 Mac, ini data yang terbaru yang saya dapat perolehi, 452,919 orang telah pun mendapat vaksin, dan beberapa orang juga telah pun mendapat full vaccination, itu vaksin yang kedua. Bila kita lihat, yang paling tinggi adalah di Selangor 55,000, okay? Dan dia paling rendah mungkin di Perlis, di Labuan, ya, disebabkan mereka populasi mereka berkurangan. Tapi kalau kita lihat mungkin daripada segi sasaran kerajaan untuk fasa pertama 500,000 orang sudah hampir mencapainya. Tapi apa yang membimbangkan adalah ini, ya. Ini adalah jumlah orang yang mendaftar untuk menerima vaksin. Okay, sehingga semalam hanya 6 juta lebih orang penduduk Malaysia, dan bila kita lihat ini hanyalah 26% daripada populasi dewasa yang telah berdaftar untuk menerima vaksin. Jadi ini adalah satu yang membimbangkan, kerana untuk kita mendapat perlindungan, untuk kita menghentikan pandemik itu, kita perlukan sekurang-kurangnya antara 70 hingga 80% daripada rakyat kita divaksinasi. Kalau tidak, kita mungkin akan berperang lagi dengan virus ni, dan kita mungkin juga akan kena PKP dan sebagainya. Jadi inilah yang membimbangkan, dan inilah tujuan utama kita adakan webinar ini, supaya kita boleh memberi penerangan dan boleh memperoleh dan meyakinkan rakyat Malaysia untuk menerima vaksin, ya. Ada beberapa orang yang nak kata anti vaksin tu saya rasa hanya segolongan kecil, tapi ada mereka yang mungkin mereka was-was, ya, dengan vaksin adakah dia selamat dan sebagainya. Jadi inilah peluang kita untuk menerangkan mengenai kebaikan vaksin dan kenapa kita perlu divaksinasi untuk melindungi rakyat Malaysia. Okay. Jadi daripada program ni adalah program yang amat menarik kita sediakan. Pertama, kita ada Profesor Dr. Mohamed Yusof. Ia merupakan timbalan pengarah Hospital USM dan juga merupakan pengurusi jawatan kuasa program imunisasi COVID-19 di kampus kesihatan USM sini. Di mana kami merupakan satu daripada pusat pemberian vaksin di Malaysia. Jadi beliau adalah amat berpengalaman untuk memberi maklumat apa yang perlu kita sediakan untuk kita menerima vaksin dan apa perlu kita buat selepas kita menerima vaksin. Yang panel kita yang kedua, Profesor Norazmi merupakan dekan Pusat Pengajian Sains Kesihatan di kampus kesihatan USM ni, dan juga merupakan pakar dalam beliau adalah Profesor Immunologi Molekular. Jadi yang tahu pasal vaksin-vaksin ni, dia dianggap sebagai pakar yang betul-betul mahir dalam benda ni, dan beliau akan memberi penerangan mengenai keberkesanan COVID-19 vaksinasi dan berapa lama agaknya bila kita divaksinasi ia akan melindungi kita daripada dijangkiti virus COVID-19 ni. Dan yang ketiga, kita ada Dr. Ajit Pal Singh. Beliau merupakan ketua biological daripada Pharmaniaga, dan beliau akan memberi penerangan mengenai COVID-19 vaksin daripada Pharmaniaga, dan apa yang perlu kita tahu mengenai COVID vaksin daripada Pharmaniaga ni. Jadi dengan tidak melengahkan masa, saya ingin mempersilakan Profesor Dr. Muhammad Imran Yusof untuk memberi penerangan mengenai dengan bagaimana kita harus menyediakan kita untuk menerima vaksin COVID-19 ini. Profesor Dr. Imran Yusof, ya. Dipersilakan.
Okay, can you listen to me? Can you hear me? Okay, Assalamualaikum and very good afternoon to all the participants. Thank you very much Prof. Dato Mafauzy and USAINS for inviting me to this webinar and to talk about how to prepare ourselves pre and post vaccination in terms of our lifestyles. For rather a simple topic, but extremely important, I guess, especially for public audience who have no or minimal medical background and have limited information about COVID-19 and about the COVID-19 vaccine, especially when the government has already started a national vaccination program. So firstly, I want to share my observation about the general attitudes towards the COVID-19 vaccine. When we talk about COVID-19 vaccine, I personally observe the different phases and changes of attitude towards the vaccine. Firstly, before the vaccine was for COVID-19 was discovered or successfully developed, especially when the cases of COVID-19 is rapidly increasing in number and the death rate due to COVID-19 was so high worldwide. I think the initial feeling was that the development of COVID-19 vaccine for COVID was probably impossible within 5 to 10 years. All right, so that is the feeling at that time. I think it is true because historically, vaccine took about 10 to 20 years to be developed. And probably the feeling of the fact that we have to accept the situation as if there is no end of the pandemic. Yes, that was the general initial feeling about the COVID-19 and about the vaccine initially. The second phase was when the vaccine was announced to be available by WHO in late 2020 and early 2021. I think there are mixed feelings about the vaccine. There are a group of people who are completely against the vaccine. Probably they are not true anti-vaxxers. Part of them, because there are religious reasons, they worry about the side effects. Then there are claim of certain drugs that they can treat COVID-19 without the vaccine. And some are totally disbelief that the vaccine was successfully developed less than a year, because as I mentioned just now, historically it was quite impossible. But interestingly, many are in dilemma whether to take the vaccine or not because of the technology of the vaccine development, which is claimed to be new using mRNA technology. That people are afraid that it can, the RNA from the vaccine can incorporate into the gene, our gene, and change the gene, right, of the people who receive the vaccine. And to the extreme that some people believe there is a conspiracy of certain government and pharmaceutical companies. Okay. The third phase is after the starting of the vaccination program worldwide. I can see the gradual change of the attitude here in Hospital USM, in which now many people want the vaccine, especially when they see their friends and their colleagues get the vaccine, sharing in the social media proudly and happily, and yet nothing happens. Nothing bad happens. Okay. Some people now can't wait for their turn for vaccination. Some people start to claim that they are, also frontliners, even though they do office job. And some people claim that their nature of work are more risky than other people, therefore they should get the vaccine earlier. Now people also have preference and want certain vaccine, and they don't want a certain vaccine, probably based on their belief and information about the vaccine. So that is the scenario that I can see about the vaccine. Okay, before I go further, there are a few important things that we know and we should know about the vaccine. Right, first, the vaccine is safe. Okay, so the vaccine is safe, and secondly, the vaccine is effective. So these are two things that we must know, and we already know. All right. How do we know that? These are based on many clinical trials done worldwide, and this is based on information and reports given by the authorized body like WHO, US FDA, CDC, and our own Kementerian Kesihatan Malaysia. And thirdly, it is very important to notice that, or to know that most of the vaccine needs 2 injections, in which the second dose need to be taken after 2 or 3 weeks to improve its effectiveness. This is an important issue as well, because the second dose can so-called affects or can give some effects on the logistic of vaccination, the cost of the vaccine, and also people talk about side effects of the vaccine itself. So if you get a side effect with one dose, what happens if you get the second dose? But there are also many other things that are still unknown about the vaccine. For example, how long the immunity will last after you take the vaccine. Whether we need another booster or the third dose to ensure that the immunity lasts. We also are not sure about this fact. How long herd immunity will be achieved, and whether it can be achieved for our country. Also another issue, because I think, as we all know, for this country, the policy is that only a population above 18 years old will get the vaccine. And some of our people, they are against the vaccine, and probably they refuse the vaccine. And our policy now in the country is that the vaccination program is a voluntary basis. So nobody will force you whether you want to take it or not, although it is free of charge. And you don't have to pay for the vaccine. And as Prof. Mafauzy shown just now, the MySejahtera registration is quite slow, right? Compared to our population, right? It's only 6 million. Okay, it is a long time to get, before we can get 80% of vaccination. The long-term side effects of the vaccine is also unknown, but to wait until we know everything about the side effects, the long-term side effects, when millions of people die and affected by COVID-19 is probably unwise. And the other thing is about the virus mutation. I think this one will be explained in depth by Prof. Norazmi. But it's something that needs to be studied further, whether it will affect the effectiveness of the vaccine or not. Now, what should we do, all right, before we get the vaccine? So these are the main part of my presentation. Okay. Right. So before vaccination happens, a face mask is a must. All right. We cannot leave our home without wearing masks, like our handphone or our wallet or our IC. We cannot live without our phone. All right. So actually, face masks save life. The risk of virus transmission when 2 people wearing masks talking with 2 meter distance or 1 meter distance is almost 0%. Okay, so it is very important to wear masks all the time. And always wash hand at least for 20 seconds using soap or alcohol. So it's not difficult actually to kill the virus. And we have to keep reminding ourselves, our family and our friends, our colleagues, and everybody around us to do this, because we do not know who actually have the virus and who can transmit the virus. Okay, because some people, they just go and expose themselves and they come and mix with us without telling us. So it's very important to take these precautions. We have also need to follow the public health measure of disease transmission prevention, which is proven to be effective, right, worldwide. So we need to avoid close contacts, crowds, confined space, and this has been, mentioned many times by the government, by Tan Sri Hisham, our DG, every day, in the media, in the TV. So this one must be done, okay? And if possible, don't organize social gatherings, all right? Parties, birthday parties, and so on. So gathering must be avoided. And if there is a gathering organized, if possible, don't go. So this is the best way to avoid, all right, viral transmission. In short, no handshaking, no hugging, no social gathering. Now about the vaccine. To get the vaccine, we need to register in the MySejahtera apps. Okay, without registering, so we cannot get the invitation and so on. So let me explain a little bit what MySejahtera will have, right? So once we register ourselves in MySejahtera, so the government generally will be able to communicate with us, all right? So notification can be sent to us, and then in terms of the dates, the assessment question related to consent and comorbidities or allergy, right, need to be mentioned. Okay, then the appointments of the vaccination can be given, and through the MySejahtera, also the reminders for vaccination, can be given to us. And if let's say we cannot turn out for the vaccination, then the date for vaccination can be rescheduled. And then it's very important also, before you get the vaccination, to get the right information from the right person and qualified person. Nowadays, it's not difficult to find those qualified persons, and the info is easily available, either in the webs, in the internet, webinar like we have today. Okay, so it's not difficult to get the right information. So because we need to understand that there are still many people out there, that are against the vaccine and try to encourage other people to reject vaccines, or probably they do not understand the science of the disease and vaccine. So before vaccination, also it is important to be aware of the contraindications of the vaccine. Actually, the contraindication of vaccine is not many, all right? Probably there are only 1 or 2 contraindications, all right? There's strict contraindications for vaccine, which is number 1 is history of severe allergy, all right? Severe allergy either to previous vaccine, food, and so on. And also history of severe anaphylaxis reaction towards any food, for example. So if you have this history, you have to inform, right, the doctors, or inform in the MySejahtera that you have this problem. Because if you have this medical background, I think generally you are not the candidate for certain vaccine, right? Please inform your doctor, because it can be dangerous, and there is probably another vaccine which is more suitable for you. And for information, actually pregnancy and breastfeeding are not contraindicated. They are just relatively contraindicated. You can still get a vaccine if you want. If you sign the consent form, I think we still give you the vaccine. But of course, I think you need to consult your UNG as well. A little bit on our national vaccination program. Generally, there are 3 phases with specific objective for each phase. Right, phase 1 is generally for frontliners. Okay, as Prof Mafauzy mentioned, about 500,000 people will be involved in this phase. Right, they aim to protect the frontliners, because the government have to protect the frontliners to ensure that the health system will continue. Right, to ensure that they don't collapse. The phase 2 of the vaccination program is to reduce mortality and morbidity of high risk groups. Okay, why these people need to be protected? Because because these are the groups of people who usually develop serious comorbidities or serious complications if they are infected with virus COVID-19. Okay, the groups are those who are above 60 years old and those who have comorbidities or diseases. And phase 3 is to generally to achieve herd immunity, okay, in which this will involve the majority or the rest of the population, right, above 18 years old and who are healthy. And this is the timeline for the vaccination program. The vaccination distribution has been done in February, and now we are actually at the phase 1 vaccination program. And now in USM, we have started our second dose, all right, for phase 1. Okay, so today the program is going on. And so far, I think 2,748 frontliners in USM has received the vaccine. And then, all right, immediately after vaccination, all right, the issue of the vaccine side effect is very important also to be informed. Side effects of vaccine is common and normal and should be expected actually. All right, it is just, you know, to show that our immune system react well with the foreign materials and powering up our immune system. So we don't have to worry so much about the side effect because it is common and most of the time the side effects are mild and doesn't need treatment or admission to hospital. So probably what you need is just probably have a rest and get PCM if you have fever. Common side effects are like local pain at the injection site. You know, you can have sore, redness, and sometimes you can get chills, low-grade fever, myalgia, headache, and so on. And this especially so after you get the second dose of the vaccine. All right, this is what happened to, you know, many of us. All right, few days ago when we get our second dose of the vaccination. But don't worry, it is mild and usually it will recover within 1 or 2 days. So what to do after taking vaccines? Okay, generally we still need to follow SOP as usual. All right, nothing much change. We still have to wear our masks. Social distancing is still very important and critical. And still we need to avoid gathering. But there are a few wrong beliefs, right, about the vaccination. Okay, so some people, you know, they presume that, okay, once they get vaccination, you know, I am invulnerable for COVID-19 disease, or I cannot be infected by the virus, or, you know, when I get vaccination, I do not transmit the virus to other people. So these are the wrong concept or wrong belief, okay, of certain people that need to be corrected. You must remember that you can still get infection, you can still transmit the virus to other people even after vaccination. But of course, the risk to get there is lower than usual and the severity of disease, all right, if you contract the virus is usually mild, all right, and that is the benefit of vaccination. And still you need to get tested, all right, if you experience COVID-19 symptoms. So you still need to be tested, okay? So in short, even after vaccination, due to many reasons, life immediately after vaccination may not change much, all right? Wearing masks, physical distancing, hand washing, and avoiding gathering are still the norms after vaccination. I think it may take few more months or years to go back to our pre-pandemic normality until or unless we achieve the herd immunity in which, you know, at least 80% of our population get vaccination. Right, so to go back to our pre-pandemic normality, I think, you know, the only possible way now that we can see is to ensure that everybody get the vaccination. All right, that's all. Thank you very much. If you have any question, then probably you can answer after this. Okay, back to you.
Okay, terima kasih banyak Prof Imran atas penerangan yang jelas mengenai apa yang perlu dibuat oleh mereka yang pergi mau untuk dapat vaksin dan juga selepas tu. Dan untuk tuan-tuan dan puan-puan yang mengikuti program kita, kalau ada soalan-soalan, boleh type dalam komen ya di bawah tu di Facebook yang tuan-tuan dan puan-puan ikuti ya. Sekarang ni kita pergi ke pembentang kedua iaitu Profesor Norazmi. Profesor Norazmi dah sedia ke? Profesor Norazmi akan berbincang mengenai dengan vaksin dan keberkesanan dia dan apakah pada segi ketahanan kita selepas divaksin. Ya, Profesor Norazmi, dipersilakan.
Terima kasih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya harap boleh nampak slide. Saya ingin mengucapkan terima kasih kepada USAINS kerana menjemput saya untuk pembentangan ini. Sebelum tu saya nak cek sama ada slide saya dilihat ke, dinampak, boleh nampak ke? Can someone indicate?
Professor, you need to share your screen. Can you share again?
Okay, hang on. It's not live. Yep. Can you see it? Can you see the screen?
All right, ladies and gentlemen, for those of you who are joining us right now live from anywhere you are, jangan lupa sekiranya anda ada sebarang pertanyaan, please feel free to put it down at the comment below. And for those of you who are claiming your USM CPD points, don't forget to go to the link that we have already shared with you and make sure you click on the link to fill in the form. Now, let's get back to the stream. It seems like a bit of technical error on our end. Let us make sure that Professor Norazmi is ready for the show. So I can see that he's ready. So let's invite Professor Norazmi back to the screen.
All right, can you see the slides now? I hope everybody can see the slides because I can't control it from here. Okay, great. Thank you. Okay, I was asked to talk about the effectiveness of vaccination and how long it will last. And as Prof. Imran has mentioned earlier, it's not, there's a lot of things that we don't know yet. But let's see what we know at the moment and see whether we can have an exciting discussion after this. So what is the current status of COVID-19 cases today? Prof. Mafauzy has shared this before. It's about 124 million cases at the moment in the world, and we have 2.73 million deaths. That's about 2.2%, right? Just want you to remember those figures. About 2.2% death, 124 million cases in the world. And if you look at the number of cases per million people, there are some countries that seem to have more, suffer more from this disease than others, above the world average: Israel, United States, United Kingdom, and Italy, and so on. The deaths as of 18th of March is reflects the number of cases in the countries that I mentioned earlier. And if you look at the number of deaths per million people, the same number of countries came out. So it goes to show that, you know, if you have a lot of cases, the likelihood of you have a lot of deaths following that is also real. These are all above world average. So this is a real problem that we are facing at the moment. We have this particular disease that's affecting the whole world. But we are very lucky in a way that vaccines are now available. And I just want to stress that the vaccine efficacy and safety has been ascertained during the clinical development of the candidate vaccine prior to approval. So even before the vaccines are used widely in the real world, studies have been shown, and regulators have ensured that all the vaccines that are being developed are efficacious and safe to be used. And now we have 4 being monitored. They are widely used now in the population, and 12 have been approved, and you will see more and more vaccines coming down the pipeline. In terms of the number of vaccine doses administered, we at this moment about 450 million doses have been administered in the world, with Asia leading it. And every day, this is daily number of doses administered. Every day, we're looking at about 10 million over. In one case, in one situation, about 12 million doses delivered every day. And Malaysia sees about 400,000 odd number of doses already delivered, with a daily rate of about 20,000 doses delivered every day. So we look at this, and we look at the number of doses per 100 people to make sure that, you know, you have proportionate representation. In Israel, United Arab Emirates, United Kingdom, and United States seems to be leading in this, and therefore real world data are slowly trickling in from these countries. And what we see in the real world vaccine effectiveness is this, reported on the 8th March by CDC. In the US, the Pfizer-BioNTech or Moderna vaccine shows 89% effectiveness in the real world, means in the population that they have given. And this, we're talking about more than 100 million people. 60% lower hospitalization rate compared to unvaccinated persons. In the UK, Pfizer-BioNTech was 86% effective among healthcare personnel, adults aged more than 80 years old with multiple underlying illnesses. The efficacy against symptomatic disease was estimated at 85%. So these are very, very good figures in the US and the UK. And in Israel, the effectiveness of Pfizer-BioNTech was 90 to 94%, effective against a spectrum of various illnesses, from asymptomatic to severe COVID-19 cases. And there's a 4-fold lower viral load compared to unvaccinated persons. So even if you are vaccinated, the viral load in vaccinated individuals is about 4-fold lower. And therefore, the question of this reducing transmissibility is there. So in conclusion from someone that published in JAMA, is that a growing body of evidence suggests that fully vaccinated people are less likely to have asymptomatic infection. So they're even less likely to be infected and potentially less likely to transmit the virus to others. However, further investigation is ongoing. As I mentioned just now, we are in a dynamic situation. There's a lot of information that are still out there that we still do not know. Remember, COVID-19 is a new disease, and the vaccines are being rolled out are new vaccines. And yet we see some very encouraging data coming out. So with vaccination, actually, considering 124 million cases of COVID and 2.2 million deaths, 450 million doses have been rolled out with no deaths. So vaccines are very safe. There's fewer moderate to severe disease, fewer hospitalization, and there's no deaths at the moment. In terms of the side effects, these are very common side effects of any injection, slightly more perhaps for this particular group of vaccines, but it is very mild. And people talk about the anaphylaxis issue. So far, after 1 million doses or per million doses administered, there were 3 reported for Moderna, 5 for Pfizer, and about 10 for AstraZeneca. And all these cases were successfully treated. More than 80% of cases had previous reactions before anyway. So they had cases of anaphylaxis before. So the actual cause is unfortunately unknown at the moment, but being investigated by many sectors. But what the point here is that the side effects are not unexpected from the COVID vaccines that have been rolled out so far. So because of all this, the CDC has come out with an interim recommendation for fully vaccinated persons. That means people who have received the complete doses of all the required doses of the vaccine 2 weeks after that, where the peak of the immune system, immune response is there and will actually hopefully stay high. So you can gather, people who are vaccinated can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household, for example, visiting with relatives who all live together without masks, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. And if you've been around someone who has COVID-19, you do not need to stay away. You do not need to be quarantined from others or get tested unless you have symptoms. So these are the CDC recommendations. However, these recommendations is not yet in Malaysia, and we have to understand that, like has been mentioned by Prof. Imran just now, you still need to try as best as you can to follow the SOP because this is a very important step that you need to take, not only for yourself, but for other people around you. And people have talked about how long the vaccine will last. And this is, again, a very difficult question to answer because we still do not have the data yet. So they're still unsure. Studies are, however, ongoing from the phase 1 studies. And more studies are being conducted with the vaccine rollout, including here in USM. We are currently doing this and to find, to look at the immune profile of people already vaccinated. So for those of you in USM, please volunteer in this study that we are carrying out at the moment. Early studies showed that neutralizing antibody persisted about 4 months, the Moderna first phase 1 study, and some companies believe that the durability will last for at least a year. Now, these are all studies of previous studies that we can actually try and wrap our mind around. So if you ask the question, is COVID-19 reinfection possible? Based on other endemic coronavirus, remember that coronavirus is not uncommon. When we have a common cold, some of these diseases are caused by coronavirus, and we do get cold every now and then, and therefore when it's endemic, there is level of reinfection. So, but in a study that was carried out among healthcare workers in the UK, when 11,000 people were infected from the healthcare worker sector in the first wave, March to April, none had symptomatic reinfection during the second wave when it came. And worldwide, there's only 31 confirmed cases of COVID-19 reinfection. And overall, reinfection seems to be rare and more common in people who are above the age of 65. However, reinfection may be underestimated due to possible asymptomatic infection, and there can be reactivation instead of reinfection, but this still needs to be studied. But what we see is that reinfection seems to be rare and maybe more common among the elderly. Now, when we look at the daily new confirmed COVID-19 cases, there's a slight worrying trend, as has been shown by Prof. Mafauzy earlier. And these can be caused by many things, but two major issues is actually the new variants and the low compliance to SOP. So I like to stress again that the SOP needs to be followed very, tightly. These new variants, I won't go too deep into these new variant issues. Maybe in Q&A, if you have any questions, I can ask. I can try and answer. But what we can tell you at the moment is that a lot of work are now being carried out to beat the variants. And some vaccine developers are already looking at second generation vaccines against emerging variants. For example, Moderna is developing the mRNA 1273.351. This is against the South African variant. Pfizer and Novavax are also doing the same. Boosters with a variant match vaccine is being considered when they have this the variant vaccine. And people are also working on multivalent vaccine containing different variants, antigens, and boosters with original vaccine is also being considered. Pfizer is also discussing with the regulatory authorities regarding a potential registration enabling study to expedite review process similar to influenza vaccine approval pathway. So people are now getting into working against the variants. So I don't think we need to be too worried at the moment, because, for example, even for the UK variant, the vaccine, the Pfizer and Moderna vaccine has been shown, even the Johnson & Johnson vaccine, have been shown to be very effective against the UK variant. So a lot of effort are currently being conducted to look at the other variants in more detail. I just want to show this slide. This is perhaps my final slide for today. Importance of compliance to SOP. Just yesterday, Victoria, Australia is considered free of COVID. I don't want you to misunderstand this slide, because this shows the compliance to SOP, but it doesn't mean that we shouldn't vaccinate. This just means that it's SOP is important, but if you don't vaccinate, you won't reach herd immunity, and the virus is still going to be around. And anytime when one spark takes place, a lot of cases will come up again. So vaccination is still very important. And if you do, if you take your vaccines and you comply to SOP, inshallah, then we will actually be able to beat this virus. Thank you very much.
Azmi, I think again for that penerangan mengenai dengan vaksin, keberkesanan vaksin, dan juga the duration of the protection afforded by the vaccine. So again, saya nak ingatkan pada tuan-tuan dan puan-puan yang mengikuti program kita, kalau ada soalan apa-apa, boleh type soalan tuan-tuan dan puan-puan dalam box comment ya, dalam Facebook tuan-tuan dan puan-puan tu, dia akan keluar di sini untuk kita bacakan kemudian. Jangan segan apa-apa soalan saja yang tuan-tuan dan puan-puan fikir agak penting ataupun walaupun mungkin agak remeh, tapi mungkin penting untuk kita sama-sama kongsikan maklumat. Sekarang kita pergi ke panelis kita yang ketiga, iaitu Dr. Ajit Pal Singh. Dr. Ajit daripada Ketua Biologicals or Head of Biologicals from Pharmaniaga. Dan Dr. Ajit will be sharing with us atau memaklumkan pada kita mengenai dengan vaksin, apakah yang vaksin daripada Pharmaniaga. Ya. Dr. Ajit, please.
Thank you, Dr. Mohamed, and thank you organizers for inviting us to this presentation to talk about our company a little bit and what we are doing. I'm trying to share my slide. Hold on. Okay. Professor, can you see my slides? Can you see my slides? Sure.
Dr. Ajit, can you please share your slide again, and we will control from here. Thank you.
Okay, wait. I think we have to. Okay, can you see now? Okay, so thank you again. In interest of time, I would like to start immediately. Briefly about Pharmaniaga. people know us as a concession holder in Malaysia, but we are also a fully integrated pharmaceutical company with 6 manufacturing sites in Malaysia and Indonesia, 6 in Malaysia, 1 in Indonesia. We have 38 distribution and logistic warehouse across Malaysia and around 3,600 workforce. Just very briefly about Pharmaniaga. We are one of the government partner for manufacturing of Sinovac vaccine in Malaysia. Mostly has through Mostly, a contract was signed between Sinovac, Mostly, and Pharmaniaga, where ready-to-fill bulk will be imported in Malaysia, and it will be filled at our Puchong Life Science facility in Puchong, KL. Okay. This is a EU certified plant, which is a small volume injectable and can manage to fill around 2 million doses per month. And this is the place where we're going to fill vaccine here. This will be the first ever vaccine fill finish in Malaysia, which is going to happen for COVID vaccine. Of course, we have a strong distribution arm which is going to distribute this vaccine across various hospitals and clinics in Malaysia, as per Government of Malaysia or KKM directions. Very briefly, my previous speakers have already highlighted what Malaysia is going to do with the vaccine and how a vaccination program is being managed. Total Malaysian population close to 32 million. And as of now, all the vaccines are licensed either 16 or 18 above years of age. So government plan to vaccinate almost 100%. They want to procure close to 26 million doses courses. On the left, you see government have already established contract with Pfizer to buy around 32 million doses, which will take care of 50% of the population. AstraZeneca will support by 10%. Sinovac through Pharmaniaga around 12 million doses, which will support 18% of the population. Sputnik V and CanSino are also in registration stage now, but they are pending approval from NPRA. This slide basically shows the various attributes of vaccine technology. As my earlier speaker said, once the COVID was identified, gene sequence was decoded, vaccine manufacturers actually tried to make the vaccine as quickly as possible. We're trying to figure out, it's okay, it's just fine. Go back to the slide. Johan, can you see our slides clearly?
Sir, you need to reshare the slide again.
Okay, just wait. Wait.
No problem.
Just give me 1 second.
It's okay. For those of you who are viewing right now, and if you have any question for all our panelists, our speakers for today, feel free to drop them down at the comment section and we will address them later on. We will have 3 speakers for today, and like Professor Mafauzy mentioned, 3 speakers will be doing their individual presentation, and once the presentation are over, we will have a short panel discussion. So for those of you who have any concerns or any question, boleh type dalam comment section and we will address them and ask our panelists to address them individually. And for those of you who still haven't liked our Facebook, please feel free to click the like section right now and give us a thumbs up, like on our Facebook, so that our USM Executive Health Services Facebook can be well known all over the world. And bear in mind that this is not the first webinar, we will have more to come. Let's have Professor Ajit, Dr. Ajit, back to the screen again. Dr. Ajit?
Okay, John, can you see my screen now? Full screen?
Not, sir. Can you try again?
What's happening here?
How about I help you? I'll share it for you, okay?
Okay, if you please share for me. Then how will I screen? When you share, I will also see it. Okay. Sure, how do we turn? John, we got the guy who can manage to share from my side. Please allow me to share.
Now the share.
Okay, I think we managed to figure it out. Can you confirm you are looking at my full screen now? Okay, Johan, can you confirm?
Yes, sir, you're on screen right now. All of us can see it very well. Thank you so much for presenting to us the vaccine profile and the comparison. So we shall proceed.
Okay, so if you look at the available vaccine profile, which are already licensed in Malaysia, Sinovac, it's an inactivated technology, more than 40 years old, has been used for various vaccine manufacturing in the past for polio, Hep A, others. And the doses are between 14, the second dose to be given between 14 to 28 day, 2-dose vaccine. But the good point about this vaccine is it's a very stable technology, and vaccine can be stored and transported at 2 to 8 degrees. Efficacy of this vaccine has been established in general population in Turkey, where it showed 83.5% efficacy. And Indonesia is still ongoing. We have interim data. I will briefly talk about these studies again. 65.2. It's a different kind of a study. This vaccine was also tested in high-risk healthcare population, where it showed around 50.4% efficacy for all cause symptoms. Pfizer is an mRNA technology. It's a new technology. There has been no vaccine in the past which is licensed using this technology to be used in 2 doses. The vaccine has to be stored and transported at -70. That's a big challenge for this vaccine. However, efficacy is very high, has shown a very good efficacy of 95%. Gamaleya, CanSino, and AstraZeneca are adenovirus vector technology. Relatively new. There are a few licensed vaccines in the past. Little better storage condition than Pfizer, -20 and 228 for some time. And efficacy is different for different vaccines because they are done in different settings. I will dwell a little bit on this efficacy numbers, that how they should be interpreted in a while. Vaccine development is a long process. I would like to briefly emphasize here, from vaccine R&D to approval and registration, you have to do preclinical animal studies in between, followed by human clinical trial phase 1, 2, and 3. This process in normal setting will take approximately 5 to 20 years. However, for COVID, there has been a rocket speed development of the vaccine, and as soon as the vaccine, the disease was identified, the organism was identified, vaccine developers had a prototype by as early as February last year. Then they immediately went to preclinical studies. I'll be talking about Sinovac vaccine, CoronaVac mainly, and what have been done for this vaccine, so people will understand that how detailed the studies are and how detailed the clinical trial data is before any vaccine comes to licensure. And this has been done for all the vaccines which are licensed so far, including the CoronaVac vaccine. Before going into animal human clinical trials, there are detailed toxicology studies where single dose and repeat dose of vaccine has to be established as safe and tolerable. They are checked for anaphylaxis in 2 different species of animals, and then the immunogenicity of vaccine is tested in 2 different species, and they were established that the dose escalation increases the immunogenicity, indicating that there is a dose-dependent immunogenic effect, making a vaccine suitable candidate for human use. The final testing was an animal challenge study where rhesus macaques, they were vaccinated and challenged with actual coronavirus wild virus 7 days after the challenge, after the vaccine, and all the animals showed protection against wild virus challenge in this study. Once all these studies were done, the candidate was taken to a clinical stage of trial, And this slide summarizes the clinical trials which has been completed for coronavirus vaccine. Most of these trials are ongoing. But when I mean completed is they have completed the preliminary analysis for licensure, for emergency use licensure or disaster use licensure. As my earlier speakers mentioned, there is still a lot to be analyzed and found out about these vaccines: long-term immunogenicity, long-term side effects, when to be given a booster dose. Those analysis is still ongoing for the phase 3 studies. Sinovac initiated phase 1 and 2 much earlier in April last year, and then they completed adult and elderly study. In fact, they also started a study in pediatric population between 3 to 17 years of age. I will talk about that study very briefly. Once that study is done, it was taken to a phase 3 efficacy study where the efficacy of vaccine was tested in real field. And these studies were done in Turkey, Brazil, Indonesia, and Chile, and 4 different countries in different kind of population. Turkey study was healthy subjects in population around 13,000. Brazil study was in healthcare high-risk population close to 13,000. Indonesia study was a different kind of a study which was intended to find out for how long vaccine is protected. The Turkey and the Brazil are the outcome is basically how much you have protection. And Chile is a recent study which has been started in January and expected to complete in May, also in healthcare population, mainly to demonstrate that the vaccine is efficacious in healthcare setting in Chile, a kind of a post-registration or post-use study. This is a very important slide. You see this is the only vaccine globally which has tested in 3 to 17 years population. The phase 1 and 2 were earlier done in healthy adults, where they use different doses schedule and different dosing schedule, like 0, 14, 0, 28, and they try to find out what is the most optimal dose and dosing pattern for this vaccine. Once they established in adult, they went to elderly, and as you can see, elderly population was up to 60 to 89 years of age. And in fact, now recently, last week, Sinovac completed a pediatric study 3 to 17, which has shown excellent results. The immunogenicity is even higher than adult population when the vaccine is used as a medium dose in 0 and 28-day vaccination schedule. This is the summary of phase 3 efficacy studies. The top 2 studies, Turkey and Indonesia, are done in healthy population. And the below 2 studies mentioned here are Chile and Brazil, are done in high-risk medical healthcare workers. The Turkey data showed 83% efficacy and for all-cause disease and around 100% protection against hospitalization, which means all the subjects who needed hospitalization in the study were in the placebo group. Indonesia study is a different kind of study. This is a time-based study which will tell us for how long vaccine is efficacious or protective. And the endpoint of this study is 6 months. The study will be completed by May this year. Interim analysis was conducted in February, where the study showed protection up to 3 months for 65.2%. This study also showed 100% efficacy against hospitalization. Chile and Brazil are healthcare worker studies. These are high-risk population, and here we see low efficacy because of the type of population, because this is the population which is dealing with COVID patient every day. So the exposure to the disease is very high. Hence, efficacy is bound to be reduced. But I will further dissect this data so that we understand even low efficacy is actually very, very helpful as a public health measure. And based on the Brazil data, the vaccine got approval in Brazil and other South American countries for emergency use. Turkey data came much later after the approval. This is an efficacy design just to trying to understand how these efficacy studies are done. In vaccine efficacy studies are a little different from pharma studies. Here you vaccinate a healthy population, either with vaccine or placebo, and this population goes back to their own respective houses. Once they have any kind of symptom which suggests of COVID disease, like fever, cough, chill, muscle pain, loss of appetite. Then they come back to the hospital and they are confirmed by a PCR test as a confirmed COVID case. And once they are diagnosed as a confirmed COVID case, they are divided into the one who have received vaccine and one who have not received vaccine. And the risk of disease in vaccine compared to the risk of disease in placebo is the vaccine efficacy or vaccine protection. The Brazil data, as I said, showed 50.3% protection. This is the dissection of the data. When these patients, as I said in my earlier slide, when they go back to the population and come back with the symptoms are classified as from score 1 to score 10. 1, they are asymptomatic. 2, they have 1 or 2 symptoms, which is headache or fever. Score 3 and 4 are given when they need some kind of medical attention like antipyretic, antiemetic, or some cough medication, or maybe an observation. Score 5 is given when they need hospitalization for oxygen or any kind of other treatment. 6, 7, 8, 9 is the score given on the severity of that patient when it is hospitalized, 10 given to somebody who has died. And based on those severity, they have been scored 6, 7, 8, 9. The Brazil data, when we dissect for all-cause disease or very mild disease, protection is 50%. But vaccine is protective up to 84% for any kind of medical intervention required. And this is a very high-risk population who is exposed to very high load of virus every day when they are treating and working in COVID hospitals. So this is not just a normal healthcare population. These are the doctors who are in the study and working in COVID wards. The vaccine now got approval from China sometime early January, and this vaccine has been used extensively already in Turkey, Brazil, Chile, and as we speak, more than 160 million doses has been shipped outside China. There are around 70 million doses which has been used in China. We got approval for this vaccine late February, and you can see YBKJ being vaccinated with the first dose in Malaysia last week. The vaccine has demonstrated a very safe safety profile as with other vaccines. I think the previous speaker also told about the side effects, adverse event, and this is the safest technology. If you compare the adverse event based on the anaphylaxis, this vaccine based on the CDC data from China has around 1 anaphylaxis per 1 million doses administered. It's considered as to be the most safest among the vaccine technologies which is available so far. I think this has already been covered. We also recommend everyone to go and register because vaccination, ultimately we can develop all the good things, but the use of vaccine only will be shown once it is taken up by the population and used by the country. We have only 6 million people registered in MySejahtera so far, so I recommend everyone to go and register. The Malaysia vaccination program not successful, everyone has to participate in it. I think that's my last slide, and we are ready for discussion. Thanks, Johan.
Alright, thank you very much, Dr. Ajit. So sekarang ni kita buka, saya nampak ada beberapa soalan ya. Joanne, can you put all the forwards on? Alright, okay. Soalan yang pertama saya nampak, saya ni mungkin saya tanya kepada Prof Imran kot. Salah Prof, berapa persenkah kemungkinan untuk frontliner yang telah complete menerima vaksin sekiranya terdapat ahli keluarga yang positif COVID? Dia nak tanya, mungkin nanti the question is, kalau dia divaksinate, kalau ada keluarga dia, ahli keluarga yang dapat COVID, berapa persenkah dia akan mendapat COVID?
Okay, terima kasih di atas soalan berkenaan. So probably Prof Norazmi can help me. But in general, okay, it depends on what vaccine you receive. Okay, so for Pfizer-BioNTech, for example, it is reported that if you get the second dose vaccine, you will be protected about 95%. So it means that there is still a risk of 5% that you may get the infection. But provided that you get the full dose or full regime of the vaccine, which is 2 doses, and you must remember that the immunity doesn't develop immediately after the vaccination. All right, it takes about, if I'm not mistaken, it's about 28 days after you get the first vaccine to get the full coverage of 95% if you take Pfizer BioNTech. Okay, so this is what the vaccine that we receive, nowadays or today, and probably with Sinovac, the protection coverage is probably slightly different. So that is my answer for that. Thank you.
Yes, mungkin Prof. Norazmi, you want to add? Maybe Dr. Ajit, you want to also add to this? Prof. Norazmi first.
Yes.
Okay. It's a very difficult question to answer very clearly. But I suppose if your ahli keluarga is positive COVID, number one, that particular ahli keluarga kena quarantine lah. Okay. That needs to be known. And Malaysia has not come out with its own requirement or recommendation as CDC. But what I'm trying to get at is that once you are vaccinated, the likelihood of you getting COVID when you're exposed to it is extremely small. And even when you get it, the symptom is very, very mild. So take your vaccine. In any situation, that is the first starting point.
Maybe Dr. Ajit, you want to add what about in terms of the Sinovac vaccine, CoronaVac? What are your chances of getting infected if you are fully immunized? Got the 2 doses.
Right. So, see, the efficacy numbers are interpreted, I will not say incorrectly, but not correctly. When a vaccine is 90% efficacious, it means that the risk of disease in vaccinee is 10% compared to risk of disease in non-vaccinee. It doesn't mean that if 100 people are vaccinated, 90 are protected and 10 can still get the disease. No, it doesn't mean that. The way these studies are designed and conducted, it means that if you are vaccinated in a population, and then you see the COVID patient, out of the COVID patients who come to hospital, 90% will be non-vaccinated and 10% will be vaccinated. So actually the protection is overall very high. That's why WHO recommended that even a vaccine showing 50% efficacy in a clinical trial in a phase 3 should be able to decrease the curve of disease, because it signifies the risk of disease, not the actual protection to the population. In a layman language, I can interpret it in this way, that a vaccine which is 90% efficacious will give you 99% protection. A vaccine which is 80% efficacious will give you around 96% protection in field, in the vaccinated. So it's the risk. It's not the number of people protected, it's the risk of disease. It has to be interpreted that way. And anything which is showing protection above 50% is good enough. Sinovac has shown protection of around 84% in healthy population. AstraZeneca has shown protection of 70%. And all these efficacy studies are dependent on the incidence of disease in that population. If you repeat the same study in a different setting, where the disease incidence is high, your efficacy result will be different. If Pfizer would have repeated the study in a country where incidence is low, it will probably get 99% efficacious. Or in a setting where the disease incidence is so high, like medical doctors or healthcare workers, the efficacy number will go down. The other way to interpret is that anything showing above 50% efficacy is good enough as a tool to change the curve of disease. So everything which has been approved by NPRA, WHO, should be considered efficacious and to be used with a similar amount of protective expected effectiveness in the population.
Okay, itu saya rasa daripada segi take home message is that walaupun kita telah divaksin, kita perlu juga menjaga daripada segi makan mask dan physical distancing, kerana kita masih lagi mempunyai risiko untuk menerima dijangkiti virus walaupun rendah berbanding kalau kita tak divaksin, dan juga kita juga ada risiko kecil untuk kita menjangkiti orang lain dengan risiko. Jadi seperti yang disebutkan oleh Prof Imran tadi, walaupun kita telah divaksinate, dual vaccination, kita masih lagi perlu patuhi SOP. Dan soalan kedua, any latest news related to Malaysians outside Malaysia who wants to return to home country regarding procedure to return and vaccinate. I think in short, if any Malaysian, if you want to come back to Malaysia, then you can come back to Malaysia. Like certain countries, for instance, Australia, New Zealand, they won't allow you to go to come back. But in Malaysia, yes, if you're a Malaysian, you want to come back to Malaysia, you can come back, but you have to be quarantined for 10 days. Okay, that's one. And as for vaccination, it's possible. Yes, you are entitled for free vaccination from the Malaysian government. You must fill in or apply through MySejahtera, and it depends on your category. If you happen to be a frontliner, you'll be in the first category. If you happen to be more than 60 years old or you have disease, then you come under the second category. But if you're none of those, okay, then you come in the third category. But you are entitled to be vaccinated as well. But you have to follow which group you are from. Okay, so itu soalan dia. Next, saya tengok ada soalan mengenai dengan okay, dia soalan mungkin saya tanya pada Prof Imran. What happen if your second dose is missed? And is the second dose different or is the same as the first dose or is booster?
Okay, thank you again for the question. In general, you have to complete the second dose within a duration period of time. All right, for example, for Pfizer, it is advised to take the second dose after 21 days. All right, but it doesn't mean that if you miss the 22nd or 23rd, you will miss the second dose. There is a period of time in which the second dose can be given in general between 21 to 41 days. All right, so hopefully you don't miss the second dose. All right, so the chance to miss actually is very low unless, that's why it's very important for you to communicate through the MySejahtera and to communicate with the Pusat Pemberian Vaksin at your center to arrange properly. All right, so that you get the second dose and it is really planned. All right, you cannot just get first dose and you forget about the second dose. So it's very important to schedule properly. That's number one. And number two, at the moment, the government will not give the second dose using the different vaccine. So if you get Pfizer, then second dose should be Pfizer as well within the time.
All right. Okay, so that answers the question. Okay. Right. The question is next is Sinovac was vaccine distributed nationwide or only selected zone in Malaysia? Perhaps maybe Dr. Ajit can answer this.
Yes, so we are basically at the discretion of KKM, and they are deciding where to use Sinovac vaccine. Being a better cold chain logistic requirement for Sinovac, which is 2 to 8, I think the first instruction for us are to send this vaccine to Sabah and Sarawak area. And we don't decide which vaccine will go. But I think the idea is that we will be used in remote places where it's difficult to maintain cold chain at -70 or -20, because this is the only vaccine which is currently 2 to 8 from the available vaccine portfolio Malaysia has.
Okay, right. Thank you. Next, I think there is a concern. There is something going on in the social media that the mRNA vaccine, I think this probably refers to the Pfizer and the Moderna, the increased risk of getting cancer. Okay, perhaps Prof. Norazmi, can you answer that? Is this true or is it not true? Untrue?
Short answer is it's untrue because there's no logical explanation for this. mRNA vaccine is there only temporarily, transiently, and then it will destroy. So there's no such thing as it change anything, no genetic changes or anything. It's an mRNA. It doesn't even enter into the nucleus to cause any changes in your DNA, which is some of the reasons why cancer happens. So this is totally untrue.
All right. Okay. So the short answer is that it's not true. Okay. All right. There's a question. I think this is a slight long question. First question is, what's the difference in effectiveness between mRNA and attenuated vaccine? I think maybe Dr. Ajit, you have explained to this, isn't it? Because it depends very much on the population that the studies were done. Right?
Right, and so as I said earlier, the difference only comes because of the population you are testing. If you test in a high disease population, efficacy is low. Remember the slide I showed where you give vaccine and you send them back, and then when they have symptoms, they come back and they test for the COVID positive PCR. Vaccines, if the incidence is so high, the antibody will probably not protect from reinfecting. They will still get infection, but then it will be less symptoms and there will be no severity and there will be no hospitalization. So vaccines will be protective, and different settings show different efficacy. US showed a very high one because the incidence is low. Turkey and Brazil showed different efficacy for the same vaccine. Turkey showed 83% because general population, low risk, low incidence of disease. Brazil, a healthcare population, same vaccine, same batch, same dosing, 0 and 14, showed little lower for all cause because disease risk was high, incidence was high.
Okay, right. The second question is that since vaccination is meant to introduce the virus to our body system, does that mean that persons already infected with the virus need to be vaccinated anymore? Maybe Prof. Imran, I think policy in terms of people already who had COVID-19, can they be vaccinated or they be excluded from vaccination?
I think the policy is still, you still need vaccination, because I think the rationale is that the immunity that is developed from the natural immunity from the infection is not long lasting compared to immunity which is developed after vaccination. So still it is advised to get vaccination, but for sure after you are recovered and after you complete the quarantine period, still need vaccination.
All right. Okay. In the market, there are vaccines that need booster doses, and there are also vaccines that require a single dose. Okay? So what are your thoughts on these vaccines? Perhaps maybe Prof. Norazmi or Dr. Ajit can answer this. Referring to the Johnson & Johnson one dose.
Yeah. Thank you. The way the vaccines are rolled out has to follow certain regulations, and if you have already done the initial clinical study the way that you have done to show the efficacy, most likely you will use the same format when it goes to the real world, because that's important to ensure that what have been tested in the clinical study is rolled out the way it is rolled out. So if a vaccine has been shown to be to provide high efficacy even with a single dose, then this is as far as possible, a lot of people just want that single dose. It's easier, but we just need to just follow the recommendation at the moment, and there are now a lot of studies being carried out to look at single dose booster for people already infected, even 3 doses that for some vaccines that will be better than this 2 dose. So what is important is that you get your vaccine according to the doses that has been recommended. Can I also, point out to question number 1, which is, or number 2, which is not really accurate. Vaccination does not mean that they introduce the virus into the body. That's important. Even if it is a virus, it is an inactivated virus, and probably Dr. Ajit can explain a little bit more on that. It's an inactivated virus, it's not the virus itself. So that's very important to understand.
Right, Professor, you are correct. It's an inactivated kill virus, and this technology has been used for polio vaccination for the last 40 years, so very well established. Coming back to the single dose, 2 dose, so this COVID did not give chance to manufacturers to do the different kind of studies where we test 2 dose, 3 dose, 1 dose. Whoever has a past experience of whatever technology they had, like Sinovac had an IPV technology for kill with a 2 dose, they followed the same path. J&J had a technology platform earlier they were working on. They saw that this is a single dose could protect for 6 months. They followed on that. But it doesn't mean that other dosing schedules are not being considered. People are now considering different dosing schedule at different time point. But the one to get first approval are the ones 2 dose for different platform, 1 dose for different platform. And it doesn't mean that one is better than other. It's just you have to take that amount of vaccine as a specific dosing schedule.
Okay. I think the next question. Right. I think this question has been answered by Dr. Ajit. In terms of the different efficacy because done different population. Right. Okay. We'll move on to the next question. Is the risk of having side effects higher in the elderly who have many illnesses such as high blood pressure, kidney disease, etc.? Perhaps, Prof. Imran, you have the experience of patients or people coming to get vaccinated and their complaint of side effects?
Right. At the moment, for phase 1, we still do not have vaccinated people above 6 years old and have diseases. So, if based on experience alone, I think I cannot answer that question because at the moment, we just vaccinate so-called frontliners which are generally above 18 and below 60 years old. But from the paper that I read, actually side effect is more common in younger patients, and also it happens especially during the second dosage. Right, it's nothing to do with the comorbidities. And example for patients who have blood pressure, I'm not aware of that. But during our process of vaccination, we can see people who, they develop so-called headache, and we measure blood pressure even before vaccination. They have, the BP is already high even before vaccination. So that is my observation. I cannot tell more than that.
Yeah, I think just add to that. I think it's true what Prof. Imran said. It tends to be higher in the younger population, and one of the reasons people believe is that perhaps the elderly population that perhaps have less side effects. Perhaps the immune system is slightly lower. So for you develop the side effects because it's your immune system that's fighting the viral antigens that's been inserted. So in a way, people believe that if you have these so-called side effects of chills, fevers, and all that, it means that you probably are better protected compared to if you don't have any symptom, i.e. you're not mounting an immune response to the virus. So that is something that people have observed, but whether it translates to these people having less protection, and which is true, I think studies have shown that in the elderly, as Dr. Ajit mentioned, the protection given by the vaccine is much less compared to the younger group. Perhaps the reason being because the elderly have a slightly weaker immune system. So, Prof. Norazmi, you want to add to that?
Yeah, that's a possibility because if your immune system is working well and you have all the cytokines coming in to attack to react against the vaccine in a positive way, you do get fever. So whenever we get a cold, for example, we get fever, and that one of the reasons is you have your interleukin coming out and doing that thing. These are mild side effects we're talking about, not the major ones, and just be aware that when you have potentially major side effects like anaphylaxis, the people who are going to deliver the vaccine will actually know beforehand based on the questions that are being asked to you. So these side effects are mild as much as possible. Yeah.
Okay, I think this is the last question because we're already 4:38. We are supposed to finish by about 4:40. This is, I think, Prof. Imran. Is it safe for pregnant and lactating women to be given this vaccine?
I think, as we all know, actually, the study actually, when they do the clinical trials, they don't cover those pregnant and lactating women. So actually, we don't know, all right, whether it is safe or not. But in the recommendation, pregnant and lactating women are not contraindicated to get the vaccination based on the mechanism of, for example, for Pfizer is mRNA. It won't cause harms. And in fact, most of the patients who are pregnant and pregnant, especially when they get infection, they get worse or bad infection. So actually, they are recommended to get vaccination, especially if they are not in the first and third trimester. So they can still get the vaccine if they want, and if they sign this consent form, we still give them vaccine. We don't stop them from getting the vaccination.
Okay, right. So yes, Dr. Ajit, last
Just to add here, On the pregnant and lactating, these are emergency use approvals. These are not full approvals for the vaccine yet. So the regulators have been very cautious because vaccines has not been tested in pregnant, lactating, and in other special population. When you develop a vaccine, you develop in healthy adult first, then followed by a special population like elderly, pediatric, lactating, immunocompromised. So far, it has not been shown that the vaccine is safe and protective in pregnant lactating, but it doesn't mean that it will not act. The science says that they will definitely be protective, and that kind of technologies what we are talking about, that they have been given in past to pregnant and lactating without any issue, so there won't be any concern. Now, since these vaccines are rolled out, we have data coming from Turkey and Brazil and China, where there has been shown no side effects in when it was given by mistake to pregnant women who were not aware they were pregnant at that point. So use of this vaccine in different parts of the world will generate more data, and regulators will probably approve it or will take it out from the kind of a caution to regular use in this population. As of now, it has to be with caution and precaution with this population because there's no data currently available.
Okey, saya ucapkan terima kasihlah kepada semua ketiga-tiga ahli panel yang telah memberi satu penerangan yang amat jelas kepada semua yang hadir. Mungkin saya sebagai rumusan ya, satu bahawa vaksin ini adalah selamat dan perlu kita tekankan bahawa kita nak seramai orang yang mungkin untuk menerima vaksin. Seperti telah disebutkan, kenapa kita perlu, sebab kita nakkan supaya kita dapat kurangkan pandemik ni dan kita boleh hidup macam balik to the old normal. Dan yang satu lagi saya nak tekankan sini adalah program-program sebegini ada amat penting sebab dengan cara kita highlightkan mengenai pentingnya vaccination ni, dia akan mempercepatkan orang untuk menerima vaksin. Dan yang penting sekali, saya dapat juga ada kajian menunjukkan bahawa bila orang dah ramai, kita yang disebutkan tadi oleh Prof Imran, kita ramai itu bukannya anti-vaxxers, tapi mereka yang kita panggil vaccine hesitancy. Mereka ragu-ragu dengan vaksin. Dengan cara yang paling amat berkesan untuk kita mengurangkan vaksin hesitancy ini, kita kerana sepatutnya bila kita terima vaksin, kita patut bercerita kepada orang lain, kita dah terima vaksin. Jadi orang mudah percaya kalau ahli keluarga mereka terima vaksin ataupun rakan mereka terima vaksin atau rakan sekerja mereka terima vaksin. Jadi bila mereka lihat bahawa orang ni sihat, tidak ada masalah, mereka pun akan juga membantu untuk menerima vaksin. So inilah saya rasa yang kita tunjukkan tadi bahawa hanya 26% saja rakyat Malaysia yang setuju untuk terima vaksin telah mendaftar. Dan ini jumlah yang sangat membimbangkan kalau kita betul-betul nakkan program imunisasi. Dan saya berharap tuan-tuan dan puan-puan memainkan peranan masing-masing. Untuk saya percaya ramai tuan-tuan dan puan-puan dah telah pun mendaftar untuk vaksin. Kalau tidak, tuan-tuan dan puan-puan tidak akan dengar program ni because you are already the converters. Sometimes a lot of this program we are preaching to the converters, orang yang dah percaya tu yang datang, orang tak percaya dia tak akan dengar. Tapi tuan-tuan memainkan peranan yang penting untuk balik bercerita, ya. Terutamanya bila tuan-puan dah kena vaksin tu, bercerita pada rakan atau itu, masuklah dalam Instagram ke Facebook ke, yang saya telah divaksin. Ya. Kita patutnya menunjukkan bahawa kita bangga kita divaksin. Ini berharap bahawa kita boleh mempengaruhi rakan-rakan kita atau followers kita lah untuk sama-sama vaksin. Ya. Kalau Perdana Menteri saja, Tan Sri Hisham saja ataupun menteri saja yang vaksin dia tunjuk tu, orang kata apa? Ni nak publicity. Okay. Tapi diri dia sendiri tak ada apa. Tapi kalau mak dia, ayah dia ke anak dia ke yang kata saya dah vaksin, mungkin dia ikut. Ya. Jadi pentingnya tuan-tuan dan puan-puan mainkan peranan untuk sama-sama kita menjayakan program vaksinasi kebangsaan. Yang penting sekali matlamat kita adalah kita hendak hentikan pandemik COVID-19 ni yang telah meragut berjuta nyawa, bukan seorang dua, 2.7 juta, dan kalau tidak dia akan meningkatkan lagi. Saya dah tunjuk, Prof Norazmi dah tunjuk daripada angka tu, dan kita sekarang dalam gelombang keempat kenaikan kematian disebabkan COVID-19. Kita semua memainkan peranan masing-masing untuk mencegah pandemik ini. Jadi Terima kasih saya tunjukkan kepada Sekretariat dan juga kepada USAINS kerana berjaya mengadakan program ni, dan insyaAllah kata di masa-masa depan kita juga akan mengadakan program ni dengan beberapa topik yang tuan-tuan dan puan-puan ingin kita ketengahkan. Kita ada beramai pakar yang boleh membincang pasal program ini. Jadi sekali lagi terima kasih banyak, dan saya pass balik kepada Joanne daripada event organizer untuk
There you have it, ladies and gentlemen. For those of you who join us for over 1 hour, terima kasih kerana bersama kami lagi dalam session pertama, USAINS Vaccine Webinar, What You Need to Know. Hari ini kita telah belajar banyak daripada experts kita. We learn a lot from our panelists and speakers on lifestyle before and after vaccination, about the comparison of different vaccine brands, the SOP, reminder, and we even get a very, very informative studies and findings from all around the world. Thanks so much to Pharmaniaga. Thank you so much to Dr. Ajit. And we have today as well Professor Dr. Mohamed Imran Yusof from Hospital USM. Thank you so much, Professor, for joining us, as well as Professor Dr. Norazmi Mohamed from Universiti Sains Malaysia. Thanks so much to our moderator as well, Professor Dato, Dr. Mafauzy Mohamed from USAINS Tech Services in Berhad. And today we are very, very honored to have Dr. Ajit Pal Singh right now from Pharmaniaga Berhad to join us on this beautiful session. I hope we will have more of this. So those of you who still have any question or any doubt, don't give yourself any more doubt. Quickly register yourself in MySejahtera and get vaccinated. All right? As you hear from our experts, it is safe. Now, if you have any more questions, feel free to drop them down in the comment below. And of course, we would like to urge every one of you to like our page for you to know more about us, to follow our issues, and of course, to learn more from our experts for more webinars to come. Till we see you again, hopefully you will stay safe and stay well at home. Stay healthy, everybody. Bye-bye.